Andrea Kane, and I'm here to talk to you about HIT 330, Health Information Technology. We are still on week 9, but now we're moving on to chapter 7, Secondary Data Sources. So let's dive into it. Our introduction, we are going to talk about how databases are used to see trends in data, and there are facility-specific registries as well as population-based registries. Databases are considered a secondary data source. A primary data source has to do directly with patient care, taking that information and using it to pull information for reports or for a registry. Those are secondary data sources. So when you establish a database, you've got to determine the content. What are you going to have in there? Make sure it's compliant with laws, regulations, and accreditation standards. Make sure you have a data dictionary, and then determine how you're going to steward, what is your data stewardship plan going to be. So I started to talk about primary data sources, secondary data sources, and again, I'm going to send you back to your book for this, but primary comes directly from the patient record. The patient record is the primary data source. Secondary is pulling information from that record and putting it elsewhere and then using it for reporting, and those are secondary data sources. There are ways to classify data: patient identifiable data versus aggregate data. There are 4 major purposes for secondary data sources. Most of it revolves around quality, performance, patient safety, research, population health, and administration. Those are the reasons for secondary data sources. That's what they focus on. People who use secondary data can be internal users or they can be external users. So they can be someone within the organization, such as in a quality management department, or they can be external, where they can be a government agency or a state agency. For instance, I worked in an organization and I was in quality management, and I was an internal user, but I was also responsible for making sure that immunization information was getting out of our system and getting to the state, the IRIS, the Iowa Registry of Immunizations, into their registry. So Iowa's IRIS system was an external user. There are facility-specific indices, not indexes, but indices, such as disease, operation, and physician. And we kind of touched on that briefly in chapter 6 when we were going through the PowerPoint there. There are registries: disease registries, cancer registries, trauma registries, birth defect registries, diabetes, implant, transplant, immunization. There are all these registries that pull data from the primary system through the secondary data source and track those types of things. Cancer registries developed through the Amendment Act of 1992. They look at case definition, case finding. They have to have an accession registry with an accession number, and all of the cases have to be staged. And as we go further into this, you'll learn more about that. They report cancer cases, they do an annual report, they have quality assessment activities, they do research, and they follow up on patients. They follow patients until they die. The American College of Surgeons is really the group that oversees cancer registry, and they have developed a cancer registry certification education program with AHIMA. And so if you're interested, go out to the American College of Surgeons and type in Certified Tumor Registrar, CTR, and it'll help you see what they have developed and that certification that you can gain. And I would really recommend that if you're at all interested, that you do this while you're going through the HIT program, because it's a great field to get into. And again, it's one that can be done remotely at home, and it's going to be a field that's going to continue to need to be followed as cancer cases continue to be pretty high. Trauma registries, these are usually done through the emergency departments because that's where this information is usually based on. But in hospitals that are like major medical centers or teaching facilities that have trauma teams and trauma units, trauma intensive care units, they have a dedicated trauma registrar who handles all of this. And they are looking at traumatic injuries. They look at case definition, case finding. They have an abbreviated injury scale, an injury severity score. They provide annual reports. Some do perform follow-up and follow the patient until death, some don't. And some only follow them for 3 years or 5 years or 10 years. So it just really depends. Birth defect registries look and follow newborns with birth defects. They have to report that. And so they have a case definition, a case finding, that type of situation. Diabetes registry, some again choose to have a diabetes registry. They register patients with confirmed diagnosis, a confirmed diagnosis of diabetes. They have case definitions, case finding, and then they follow up. Implant registries are, those have become a lot more common. Typically, implant and transplant registries are managed out of the surgery department. They are keeping track of pacemakers, heart valves, tissue implants, joint implants, also all those types of things. They have case definition, case finding. They also are involved with FDA reporting. And if any of those are recalled, they have a significant role in identifying which patients have these implants and what is the process for notifying them when they have a recalled implant and how is it taken care of and followed up on. So that's the implant registry. Transplant registries are all about organ transplants. They track patients who need transplants, patients who have had transplants. These are typically at major medical centers that do the organ transplants. And again, this may be done out of surgery, or the surgery department, or they, for instance, if it's a major medical center that specializes in heart transplants, shall we say, then they may have a dedicated registry person who only manages their heart transplants. So it just really depends. Immunization registry, these are pretty much electronic now. This is all done through computers and artificial intelligence. They pull the immunization information from the providers and send it to a statewide registry, and it's watched there. The systems can also track when immunizations are due, and they can be set up to alert parents, especially through a patient portal or PHR or those types of things, that child's coming up for immunization or an immunization is past due. Other registries, there are some that have been created for cardiovascular diseases or gastroenterology conditions. You think about Crohn's disease and things like that. So there are some other registries, and again, they're managed differently by different organizations, different healthcare organizations, depending on how they have their programs set up. It may be out of the cardiology department versus out of surgery or out of primary care or out of population health. It just depends on how they want to do it. And then there are some administrative registries that can be created, like the National Provider Identifier Registry. Every provider has an NPI number, a National Provider Identifier. And there is a registry for that where you can go out and find out what your provider's NPI number is. And that's typically used by people who do medical staff credentialing and privileging. So that's another example of a registry. Healthcare databases. There are national as well as state administrative databases. This talks about the Medicare provider analysis and review process and how that works. And I'd refer you again back to your book for that. National Practitioner Data Bank. This is used through medical staff service departments across the nation when they're doing credentialing and privileging of the medical staff. You have to query the National Practitioner Data Bank every time you are preparing a provider for credentialing. It is mandatory. I know this because I was over medical staff services for a while, and I actually helped with the credentialing and privileging processes. And so, yeah, I'm very familiar with the National Practitioner Data Bank and have actually queried that myself. All right, so there are other databases such as public health. And that can be public health on a national basis. It can be state public health. It can also be county public health. So again, they're monitoring incidence and prevalence of diseases, possible high-risk populations, survival statistics, trends over time. Good example is COVID. Infection control departments in hospitals across the nation have had to report almost daily, and sometimes actually daily, their COVID rates and their COVID death rates. So that's an example of public health database. National Healthcare Survey. I'm going to refer you back to your book for this or online because you can take a look from there and get more information. I'm not going to spend much of any time on that. So healthcare databases, we talked about public health, we talked about national and state administrative databases, we talked about immunization databases, and all those types of things. This just gives you some more examples. Vital statistics. It used to be, back in the day, HIM was heavily involved with vital statistics. They did birth certificates, death certificates, those types of things. Vital statistics is known as, births, deaths, fetal deaths, marriages, and divorces. And typically that is collected by the state, but it is managed on a county basis. Typically is managed on a county basis. Back in the day, HIM, like I said, was involved with birth and death certificates and fetal death certificates in the hospital setting. Pretty much now that is gone. Nursing, the labor and delivery unit in each hospital pretty much handles birth certificates all by themselves, although back in the day I did do it, so I am very familiar with birth certificates. HIM sometimes helped with death certificates, but typically that was also done on the nursing unit. And where HIM got involved was that after the patient was discharged, or after the body was released and the record came down, sometimes we had to chase down physicians to sign off on death certificates. So that's the historical there. But that's all done electronically now by the nursing units. Same thing with fetal deaths. That's all labor and delivery units that handle those. And then marriages and divorces, thankfully, are not done by hospitals. But I will tell you, when I was in Florida, I was registered as a notary for the state of Florida. And at that time, Florida and Maine were the only two states where notaries could perform marriages. And yes, I had the chance to perform a marriage when I was a notary in Florida, working in a healthcare organization. The groom's mom was passing away from cancer. She was very, very ill. I think she passed away 3 days after they got married. And they asked me as a notary if I would marry them in their mom's hospital room, in his mom's hospital room. And so I did. It's a sweet story, but yeah, that's the one and only time in a healthcare related setting I have anything to do with a marriage certificate. But those are all kept typically by the county, but the information is aggregated and maintained by the state. And it's shared with the National Center for Health Statistics. And when you get to spring of your second year in the HIT program, you will have statistics class. And it just so happens you'll have it with me. And we will go through calculating statistics on births, deaths, fetal deaths, marriages, and no, not marriages and not divorces, but we will do births, deaths, and fetal deaths, among other things. So along with incident rates and all sorts of stuff. So you have that to look forward to. Clinical trials. There are many healthcare organizations involved in clinical trials. These are research projects where new treatments or tests or drugs are being investigated and tried with patients, and patients are very closely monitored. There are protocols for this. You can go to clinicaltrials.gov and get all sorts of information. If there's something, a type of study you're interested in or a location of a trial, it'll give you all that information. So that might be fun to do. Health Services Research Databases, these are available. AHRQ has a lot of databases that people use for healthcare cost and utilization. There's just so much out there. You really just need to know where to go and look. National Library of Medicine, this used to be, no, National Library of Medicine, sorry, I was thinking of the other one. This is available as well. It's called Medline, and it's a great place to go for medical articles, medical journals, medical articles, and things like that. And you will find that you may use Medline as you go through the program, and I have you look at articles that are there. Let's see, health information exchange. You will focus on this in a number of classes, but health information exchange uses patient-specific data for patient care and makes it available beyond organizations. So for instance, sometimes states develop a health information exchange, and sometimes it is a region, and sometimes it just may be two health systems that put together a health information exchange. It varies depending on where you're at. I have seen them used, and it's basically a way that providers can query for patient care information on patients that they're treating that may have been treated in another organization that the treating person doesn't have access to it. And so health information exchanges provide that. Data for performance measurement. There are core performance measurements called core measures. They're required for Joint Commission CMS and some health plans. And so we'll talk more about core measures as we go forward. And then HIM roles. We collect secondary data, we analyze secondary data, we make sure privacy is maintained, we may be a registrar, we could be a database administrator. And that is it for Chapter 7, Secondary Data Sources. And that ends week 9. I'll be back next week, which is week 10, to talk to you about chapters 9 and 10 on data privacy and confidentiality and data security. So take care. Have a great week and have fun with data management and secondary data sources.